Well, good afternoon, everyone. Thank you for joining us on KREM 2 News First at 4. I'm Tom Sherry.
And I'm Whitney Ward. We begin now with breaking news. Hundreds more local COVID cases announced today. 718 new cases just confirmed today. To give you a little perspective, yesterday it was sitting at 203.
So if there's any good news to these reports in these numbers, it is that our daily hospitalizations are not spiking nearly as high today in Spokane County. There are only 78 patients hospitalized because of COVID, but last fall the hospitalization numbers were much higher because of the Delta variant. And while we are seeing a steady climb in those numbers, hospitals so far are not yet at their capacity.
So we want to take a look now at a graphic that shows the daily numbers since the very beginning of this entire pandemic, way back when things started. We haven't seen numbers this high again in more than a year. It was on last December the 8th, as you can see. That was the last spike where we had 719 cases reported in a single day. Again, today it is 718, so just one shy of that all-time county record.
So we have team coverage this evening so we can touch on all aspects of these case surges. Ian Smay listened in on a briefing from Providence Health today. He'll tell us what they're saying about Omicron spread in our area.
And we have experienced it ourselves. You probably have too. Finding a COVID test is nearly impossible right now. Our Janelle Finch is in the studio tonight as well with an update on testing availability. Also, I reached out to the Department of Health about how they're planning to get tests here to the east side of the state. We'll get more to that in just a moment. In the meantime, Providence's chief medical officer gave a very stern warning of the impact that Omicron could have here locally. Today, he talked about a probable upcoming surge in cases.
So that surge could lead to increased hospitalizations. Our own Ian Smay listened to that press conference and joins us in the newsroom with more on that. Ian.
Dr. Dan Getz spoke for about 30 minutes today about the impact Omicron is and could continue to have on local health systems. One thing he talked about was how the already present staffing issues hospitals were facing are being made worse by this new variant. Getz said that Providence is experiencing more healthcare workers getting sick with COVID or being exposed and having to be tested before returning to work. This is compounding the staffing issues hospitals are already facing as they continue to treat high number of non-COVID of not just COVID patients, but also those sick with other illnesses. They are also performing surgeries that may have been delayed due to previous surges, and Getz warned of severe consequences if the staffing crisis gets worse and hospitalization numbers get too high.
You just can't deliver care to everybody. And we're already at a point now where staffing's incredibly challenging. And if we see lots of ill calls and a high volume of patients, this really could drive the state into a crisis standards of care setting.
Getz also said this is impacting the amount of testing they can offer people. He did say that the peak of hospitalizations during Delta was a lot worse than what Providence is currently seeing, but it is on par with the first surge during the pandemic. Getz talked about a lot more topics when it comes to COVID locally, such as mask wearing and testing. I'll have a full wrap-up of that press conference at 5 tonight. For now, back to you.
All right, Ian, thank you very much. So these are the numbers that we are seeing across the country today. Coronavirus infections just shattering records here in the U.S. More than 1 million new cases were reported yesterday alone. Taking a look at this number here, yesterday we know that number likely included totals from Saturday and Sunday, that million case number. The 7-day average, though, of new cases now close to 500,000 every single day.
So yesterday we talked about the challenges that Omicron is creating for our local testing sites. Well, today we're asking questions about some solutions.
So KREM 2's Janelle Finch is joining us now live to tell us a little more about how health officials are trying to get a handle on those increased testing demands. Hi, Janelle.
Cars were directed into 2 lines at the Spokane Falls testing site today. Discovery's regional manager says this is just one of the ways they're working to make testing faster and more accessible, but the real need is more staffing. With only 2 local mass testing sites, Spokane residents looking to get tested for COVID are having to allocate up to an hour of wait time. Both testing sites have 500 tests for each day of operation. Discovery Health has plans to increase testing capacities by mid-month, but having enough staffing is delaying that goal.
Been working to try to keep up with volume. It's definitely taking a toll. So also the double volume of the onset of the new variant has also been really hard for us to match staffing measures.
Discovery's regional manager says its goal is to provide 1,400 tests each day, but there are necessary steps before getting there.
Once we have staff onboarded and fully trained and ready to do the job at capacity. So there's definitely a little bit of delay and variance in that, but that is our goal.
Providence Health also talked about staffing shortages, saying people are the most valuable asset when trying to provide more local testing access. Discovery's regional manager also says a way for the public to help move lines faster is by pre-registering for tests and submitting information online before visiting the site. Health officials are also encouraging those looking to get tested to consider other testing options like going to a local health provider or visiting a local library for curbside testing kits. Spokane Regional Health told me they've provided nearly 6,000 kits to local library systems to distribute to the public. I also called a couple of those participating libraries, and they told me if you're looking for kits to call and ask for availability. Janelle Finch, KREM 2 News.
Thank you, Janelle. North Idaho is also seeing an increase in COVID testing demand. The Panhandle Health District says if you are looking for an at-home test, why don't you try chain pharmacies like maybe Fred Meyer or Walmart. PCR tests are available at any local healthcare facility. You will need a referral, and the health district can help you get one. The health district also has a vault test available. Now, these tests require you to spit into a vial and then mail it to the lab. You can expect your results from that vault test in 48 to 72 hours.
Also, just to let you know, we did reach out to the State Department of Health today just to ask if there are any plans to kind of increase testing availability here in eastern Washington. Officials told me they couldn't answer our questions today, but said they are planning to hold a briefing sometime soon to discuss those testing options. So we'll keep asking those questions, and we'll bring you an update just as soon as we get those answers. In the meantime, the Washington State Board of Health is considering adding the COVID-19 vaccine to the list of vaccines for K through 12 students that they are required to have to attend school. So the board is now asking for public comment on the issue. Those comments must be submitted by Friday at noon to the email address that should be there at the bottom of your screen. I don't see it there, but we do have that information on our website. In the meantime, the Meade School District sent a letter to parents urging them to comment and to take a survey on thoughts for a COVID vaccine for students. Those comments will be part of the board's meeting next Wednesday when they could take action, preliminary action. Right now, there are 11 vaccines that students are required to have if they attend public school. Those include things like measles, mumps, polio, and chickenpox. However, the state does allow for medical and religious exemptions. The University of Washington will return to remote learning for the first week of the new year. Leaders there say they want to give students time to watch for symptoms and get tested following holiday gatherings. It will also give them more time to get those booster shots for the COVID vaccine. Students are expected to be back in classrooms by January 10th. And Gonzaga University, we did ask today, they are requiring COVID-19 booster shots for all vaccinated students, faculty, and staff. Gonzaga said people must get that booster shot within 14 days of becoming eligible. Students should update their status with booster information no later than Friday, January 21st. Gonzaga is also requiring that all students, regardless of their vaccination status, get tested for COVID 48 hours before they come back to campus.
So we also reached out to WSU. They say they're going to still resume in-person learning on January 10th. Leaders say that the high vaccination rate among their students and faculty members makes them pretty optimistic. WSU will host a town hall on Thursday to review the university's COVID-19 guidelines.
And we know that was a lot of information, so if you would like some links to our articles with all the information, the latest information, all you have to do is text the word COVID to 509-448-2000. We'll send all of that info right to your phone.
Well, weather-wise, my gosh, we're going to get a little bit of light snow late tonight, maybe about an inch, but we are still tracking the potential for heavy snow headed our way late Wednesday night into Thursday morning. That's a live look outside right now. Main roads still in pretty good shape. Side roads really are pretty much a mess. If we could show you the watches and the warnings here, there we go. Everything shaded in blue, that's the winter storm watch. And as Whitney Ward has told you many, many times, a watch doesn't mean it's necessarily going to happen, just that it could happen. When it gets upgraded to a warning, that means it's imminent, that 99% sure it's going to happen. So we still see the potential for 4 to 6 inches of snow falling in the valleys across all those areas you see there shaded in blue. Obviously, a lot more would fall in the mountain areas. This is Snoqualmie Pass right now, and it's been tough going or tough sledding across the pass from the weekend through today. And we've got more snow on the way later tonight, and as I said before, Wednesday night into Thursday. today. So right now we're at 30 degrees. Wind is out of the south-southwest at 5 miles per hour. And again, pretty dry right now. We do have snow and a rain-snow mix that's occurring down in the lower Columbia Basin. And as you look closer here to home, just a few snow showers in pretty much northern Shoshone County. We'll look for temperatures to hit 26 tomorrow after an overnight low of about 19. Wednesday should be a mostly dry day. Then by late Wednesday night into Thursday, that's the snow. Could be heavy snow at times. 4 to 6 inches of heavy, wet snow. And you want to get that shoveled in the morning if you can, because we're going to get above freezing on Thursday. And then look what happens on Friday. It gets sloppy. Chance of more rain and snow with a daytime high of 40 degrees. We'll check the weekend and your 7-day forecast coming right up.
And we just went into a mode where we're getting these kids out, we're getting them safe.
Well, some Good Samaritans pulled nearly a dozen children from a house fire, but firefighters then discovered so much more at that house. We've got that story coming up next after the break.